Welcome to the Dr. Mark J. Pamer podcast, a doctor who uses his heart to treat your lungs. Here's your host, Dr. Mark J. Pamer.
Welcome back, everyone. I'm back in the studio with Dr. Pamer. I'm Garfield Bone, co-host / producer of the show. Dr. Pamer, how you doing today?
I'm great, Garfield. Thanks for having me.
Listen, we have some questions. I know you get it a lot. You're a doctor. Everyone comes in, they have a question for you. The question for today is, what else is there for my heart disease?
Wow, it's a great question because we live in an age where it's medicine, and that takes us to a distance. But there's more than just the pills. The medications are life-saving. Some of the data on them is not nearly as strong as we would like to think, but they save lives. But people may still be short of breath, and they may still get coronary disease. They may still have, heart attacks, and even if they've been bypassed, their stents their bypasses may still clog. So the question's really great. Look, I'm seeing a brilliant cardiologist, and I'm on all these meds and aspirin and maybe Plavix, and I'm on the statin, and I'm on my beta blockers, and I'm on this, and I'm on that. But what else? Well, great question. And the answer is rehab. I don't mean drug rehab, right? I don't mean inpatient rehab where, you're going to go away for several months. I'm talking about cardiac rehabilitation. And that really can be the secret weapon in getting you back to your old self and even better. What's cardiac rehab? Well, there's two different types. There's traditional cardiac rehab and there's intensive cardiac rehab. And those are very, very different. Cardiac rehab is pretty common. It's usually twice a week, sometimes 3 times a week, and might last 90 minutes. It's usually hospital-based. And there is some education on things like diet and exercise and heart disease, and then time on a treadmill, bicycle, et cetera, with rehabilitation people. And generally, when you're done with that, you can walk further and you're doing better and you're less short of breath. And, and hopefully you take those skills and you move forward. Intensive cardiac rehab, that's something that we offer in my office that I become a strong believer in. Intensive cardiac rehab is twice as long, much more intense. And by intense, I don't mean that we're training anybody for the Olympics, but we're doing a lot of education. In order to do intensive cardiac rehab, it has to be a Medicare certified program because it's based on one of 3 programs that have been published in evidence-based, peer-reviewed literature, which has actually been shown to reverse coronary artery disease. That's huge. The term reverse is not used lightly. The people that do these programs have actually been able to have a reversal of coronary artery disease. And you really can't say that, but very, very minimally in other avenues in cardiology. It's not even discussed. So in intensive cardiac rehab, there's much more emphasis on diet and the role of vegetables and low fat, sort of the Mediterranean style diet. There's cooking classes. There's actual hands-on training on what to do and how to cook and what to use and what the person can use in their diet to help stop the progression of atherosclerosis. There is much more education on heart disease and on the prevention of it and on exercise and rehab and lots of education that you're not getting in traditional cardiac rehab. For that reason almost alone, it's twice as long as far as the number of sessions and the time, and therefore there are far superior benefits. But coupled with this great increase in education, there's also, as I said, there's time on the treadmill or the bicycle if appropriate, lightweight training, all kinds of stuff, isometric training to get a person stronger, get their heart going, and to get them in much better cardiovascular shape, coupled with a program where you're dealing with the underlying physiology and their cholesterol levels and their plaque formation to help reverse that. So this can be huge. This can really be the secret weapon in getting a person back to walking distances or doing things that they couldn't possibly fathom before when they started. Really, rehab. That takes you the rest of the way at getting better.
Wow. Thank you for sharing, Dr. Pamer. We'll see you on the next episode.
I look forward to it. Thanks.
Thanks for listening to the Dr. Mark J. Pamer podcast. To learn more about the doctor who uses his heart to treat your lungs, go to markpamerdo.com or call 772-785-5864. Once again, that's 772-785-5864.